Welcome back. Guidelines for quarantining have been cut in half. That was suggested by the CDC. Vaccinations boosters are still strongly encouraged, but some of us might feel like there are some mixed messages coming from top health officials. Joining us now to help sort it all out, Dr. David Zich with Northwestern Medicine. Good morning, doctor.
Good morning.
So let's first go over these CDC guidelines, walking back these quarantining guidelines, in particular for positive COVID patients not showing symptoms, right?
That is correct.
Okay.
Right. It is not for everybody and not for everybody who is vaccinated. If you don't have symptoms, that's when you apply these.
And this is kind of confusing though, right? Because Omicron is supposed to be, very transmissible. So I think a lot of people, they're scratching their heads on this one.
Sure. Well, and saying walking back the guidelines, it makes it sound like there might have been a mistake to begin with. Really, they're issuing new guidelines based on new data for people who are vaccinated. The original guidelines were created in a time when there were no vaccines. Now we know that vaccinated people shed the virus less, are less contagious for a much shorter period of time. So we've been asking for these to be revised for a while, and some countries are starting to do that. We just feel that the CDC might have done this a little bit abruptly, may have been a little bit too liberal on their guidelines, but we're working with it and seeing what happens.
Yeah, this is all new, right? Everything
That's
about
right.
this is new, and the research is still ongoing. So now we're hearing, as of this morning, that Omicron might not be with us for very long. Crossing our fingers for that, right? Because it's so transmissible. There's so many cases. There's outbreaks. Maybe it will run its course and quickly go away. What do you think?
So we are seeing that in other countries. Places like South Africa had a very sharp rise, but then a sharper fall than normal. There's a few concerns here. First of all, we thought that at this time, Omicron represented over 90% of the infections, while revised data has put that more at 60%. So we may see a very sharp rise of Omicron and then a fairly sharp fall, looking at maybe February or so when we start seeing Omicron disappear. But Delta may still be around, and that's what we're concerned about.
So let's talk about Omicron. It's more transmissible, said to be less severe. So we're seeing lots of cases, but we're also seeing lots of hospitalizations and lots of deaths. I think 96 reported in the state yesterday.
That is correct, right. And so there's some misconception here that deaths are just going to go away because Omicron is here. Well, first of all, Omicron is sharing the stage with Delta, which is just as potent as it used to be. Second of all, because Omicron is so contagious, we're seeing incredible numbers of people who are infected thanks to the holiday gatherings. And so even if you have a very small percentage that are sick and dying, small percentage of a very large number still represents a lot of people.
And an immunologist out of Britain is kind of guessing, right? Because this is the research is ongoing, but they're predicting that the high COVID death rates are history. Do you share that optimism?
Yeah, well, once again, first of all, nomenclature. A death rate means the number of deaths per people infected. And we do know that that's going down. Okay, because Omicron's a little less lethal. We know there's prior immunity from infection and immunity from the vaccines. But again, because we have so many people who are getting infected, that small percentage that are getting severely ill still represents a large number of people. So to say that death rates might be history is a little misleading. Mm-hmm. Deaths from COVID are not history, and they will not be history. And our overflowing ICUs is a testament to that.
So let's talk about those long lines outside testing centers, right? This is what officials want us to do. This is what you want us to get tested, right? When we have maybe a sniffle or something, because this is so transmissible. A lot of us are vaccinated. We want to be tested, but I'm personally hearing some issues with the rapid tests, possibly coming back positive. And then you get worried, you think, oh, I got COVID, but then your PCR comes back negative. This is actually the opposite of what we saw before this variant, where our rapid would come back negative and then the PCR would come. It's kind of very confusing. But can you talk to us about these rapid tests and the validity of these rapid tests?
Yeah, so the rapid tests oftentimes will have a false negative. It is unusual for them to have a false positive. The PCR is more sensitive, and so we used to see the rapid test being negative and then the PCR being positive, a true positive. There's a couple of theories we have, though we can't say exactly why the PCR might be negative when the rapid is positive. First of all, you mentioned long lines. So people may be rushing a little bit to take the sample, not getting an adequate sample, leading to a false negative PCR. But possibly more likely, we've said that vaccinated individuals who are getting the virus and are having some mild symptoms clear the virus more quickly. Therefore, the usual thing is people get a positive antigen test, and in the next day or two, they find a PCR test to do. It is certainly possible that vaccinated individuals are clearing the virus in those 1 to 2 days before they get their PCR test, and that's what's leading to the discrepancy.
Interesting. Okay. Well, I can't believe this, but we're about to enter year 3 of this pandemic. It's quickly approaching. Pandemic, lockdowns, masks. Can you look back and tell me, are we at the stage where you thought we would be? You know, a good 2 years in and about to be 3 years in.
Yeah, we've been broadcasting on this for a very long time, haven't we? And when it first started, we were not really looking this far ahead. No one was really trying to make a prediction when this was going to be over. We were doing everything we could to keep up week to week. And those people that were creating prediction models for a month ahead of time were usually wrong. So trying to predict where we were going to be in 2 to 3 years, nobody was really doing it. Then vaccines came out and the dust started to settle, and there was one predominant message that I and others were saying, that until the world gets access to vaccines, this COVID pandemic will not end. This Omicron variant that came out of South Africa accentuates this. But I do want to tell people that the pandemic will end, that we are getting the vaccines out to the corners of the world. There are better vaccines in the pipeline. We have pills that are coming out that are treating it. It's a matter of time. I can't say when that will be, but the pandemic will end eventually.
Glass half full. Thank you so much. Dr. David Zich with Northwestern Medicine. Thank you for what you do and for your time this morning.
Thank you.
Thank you.